This talk is about allowing for silence, and part of a series on therapeutic communication for psychiatrists. For a psychiatrist, using silence effectively is an essential skill in diagnostic interviews, and especially in psychotherapy. But why is allowing for silence important? To find out, let's review the many different functions of silence in the practice of psychotherapy. The first function is facilitative, which allows the patient to engage in free association. Free association, in essence, refers to expressing thoughts freely without filtering or censorship. This helps uncover exactly how the patient thinks and feels, which helps the psychiatrist to understand the patient's internal experiences on a deeper level. Another way of thinking of this is that silence is an invitation for the patient to speak their mind freely, without worrying about being interrupted, judged, or otherwise receiving negative consequences. The second function is reflective, which allows the patient time to reflect on what has been said. Many complex and challenging thoughts, emotions, and experiences are often discussed in psychiatry, and the patient may need time to reflect on what has been discussed in order to respond accurately about these complicated topics. In this view, silence is a pause to think, feel, and reflect without pressure to respond right away. In the often stressful environment of a doctor's office, hospital room, emergency department, or wherever you may be working with patients, a pause is often a great way to relieve some pressure. The third function is communicative, or a way to convey emotion. When a patient has disclosed something stressful, embarrassing, traumatic, or otherwise highly emotional, allowing for silence can be a very effective way to honor and give weight to what the patient has shared. In this way, silence can be a show of care and empathy to the patient. The fourth and final function of silence is strategic, which refers to using silence to challenge the patient. Some patients struggle to share what's on their mind, or even struggle with silence in general. For example, highly anxious patients may be unable to quiet or steady the flow of thoughts in their minds. Allowing for silence gives the patient the opportunity to practice sharing their thoughts and feelings, even though it may be uncomfortable at first. Just like any skill in life, this is a skill that requires practice, and the psychiatrist's office is a great place to practice. In other words, silence can be an exposure to the contents of one's own mind. And just like with any other exposure in psychotherapy, as you expose yourself to it over and over, it gets easier to deal with. In this view, silence is also diagnostic. What I mean by this is, based on how a patient deals with silence and with their own mind, can demonstrate how well they respond to internal stress, which is one aspect of their ego function. So, in summary, the four functions of silence are facilitative, reflective, communicative, and strategic. Let's move on to discuss the skills that the psychiatrist can use to allow for silence. The first skill is preparing the patient for how you use silence during the therapeutic encounter. When I first start working with a patient in psychotherapy, I explain to them how therapy is a different kind of experience than a normal conversation, and that it will involve me remaining silent for some periods of time to facilitate their psychological growth and reflection, as well as the other functions of silence we've discussed. The next skill is building rapport, or building a therapeutic alliance. In general, the stronger your rapport with the patient, the more the patient will respond to the intended functions of silence. The next skill is using open-ended questions rather than close-ended or leading questions. Open-ended questions are any questions that cannot be answered with a simple yes or no, and they usually begin with how or why. For example, how are you feeling right now is a good open-ended way to ask about a patient's current emotions, and why did you do that is a good way to ask a patient to reflect on a past behavior. The next skill is creating an environment of physical and psychological safety. This involves maintaining a consistent framework and boundaries within the therapy space so that the patient can feel safe talking to you. For example, this might mean consistent rules such as having a consistent meeting space and meeting time, and enforcing safe boundaries such as no physical touch. The last skill is encouraging the patient to continue speaking and free associating by demonstrating active listening. This involves back-channeling, which refers to the verbal and nonverbal indicators of active listening. Verbal back-channeling includes brief statements and verbalizations, such as, uh-huh, or I see, while nonverbal back-channeling involves nodding your head, furrowing your eyebrows, or smiling. These skills can be remembered with the mnemonic PROS. That's the end of this talk. I hope this is a useful guide to the essential skill of allowing for silence, and I hope this inspires you to use silence in your own practice. Thank you.